Fortifying Health, Advanced Strategies for Disease Prevention in Livestock and Companion Animals. Disease prevention in animals is a cornerstone of responsible stewardship. Whether you're managing a commercial farm, raising backyard poultry, or caring for household pets. From viral outbreaks to parasitic infections, understanding how to mitigate these threats ensures longevity, productivity, and ethical treatment of animals. The approach to disease prevention varies widely depending on species, environment, and management practices. However, foundational principles such as hygiene, vaccination, and early intervention remain universally critical to safeguarding animal populations against illness. Vaccination programs, building immunity through science. Vaccines serve as one of the most effective tools in preventing infectious diseases among animals. By stimulating the immune system to recognize and combat pathogens, vaccinations significantly reduce morbidity and mortality rates across livestock and companion animals. Core vaccines protect against diseases such as rabies, distemper, parvovirus, and avian influenza, while non-core vaccines address region-specific or lifestyle-related risks. Regular booster shots ensure sustained protection over time. Customized schedules. Vaccine protocols must align with species, age, and exposure risks. Puppies, kittens, and young livestock require initial series followed by periodic boosters. Herd immunity. In communal settings like farms or shelters, widespread vaccination reduces pathogen transmission, protecting even unvaccinated individuals indirectly. Nutrition and diet. Fueling resilience against illness. A balanced diet plays a pivotal role in strengthening an animal's natural defenses against diseases. Nutritional deficiencies weaken immune systems, making animals more susceptible to infections and slower to recover. Incorporating high-quality protein sources, essential vitamins, such as A, C, and E, and minerals like zinc and selenium supports optimal cellular function and immune response. Feed formulations must consider species-specific dietary needs. Case study. Malnutrition and disease susceptibility studies show that malnourished calves infected with bovine respiratory syncytial virus, BRSV, experience higher mortality rates compared to well-fed counterparts. This highlights the interplay between diet and disease resistance. Supplemental feeding during drought seasons or periods of stress further mitigates vulnerability. Probiotics and prebiotics may enhance gut microbiota diversity, reinforcing digestive tract immunity. Biosecurity measures. Creating barriers against pathogens. Implementing rigorous biosecurity protocols minimizes the risk of disease introduction and spread within animal populations. These measures are especially vital in high-density environments like feedlots or breeding facilities. Key practices include quarantining new arrivals, restricting visitor access to animal zones, and disinfecting equipment regularly. Footbaths and hand-washing stations at entry points prevent cross-contamination. Zoning policies. Separating sick animals from healthy ones prevents secondary infections. Isolation pens near barn exits facilitate safe handling of ill individuals. Vector control. Mosquitoes, ticks, and rodents act as carriers for numerous diseases. Integrated pest management strategies curb their presence effectively. Parasite management. Targeting invisible threats. Internal and external parasites pose significant health risks to animals worldwide. Worm infestations, mange mites, and lice not only cause discomfort but also compromise overall wellness and production efficiency. Frequent deworming regimens tailored to local prevalence patterns are essential. Rotational grazing techniques help break life cycles of gastrointestinal parasites in ruminants. Diagnostic testing. Fecal egg counts determine appropriate anthelmintic dosages, reducing drug resistance development. Topical treatments. Spot-on treatments and collars provide long-lasting protection against fleas, ticks, and mites in companion animals. Early detection systems. Leveraging technology for timely intervention. Modern advancements enable real-time monitoring of animal health indicators, facilitating prompt action before conditions escalate. Wearable sensors track temperature fluctuations, activity levels, and heart rate anomalies. Automated milking machines equipped with somatic cell counters alert dairy producers to mastitis cases earlier than traditional methods allow. Thermal imaging cameras identify febrile animals within herds efficiently. Data analytics. Cloud-based platforms aggregate health data trends, enabling predictive modeling of potential outbreak scenarios. Telemedicine. Remote consultations with veterinary experts streamline diagnosis processes for rural or remote operations lacking immediate clinical support. Zoonotic disease mitigation. Protecting human and animal health. Zoonoses represent dual threats, affecting both domesticated animals and humans who interact closely with them. Rabies, leptospirosis, and toxoplasmosis exemplify diseases requiring coordinated prevention efforts. Regular vaccinations for pets against rabies and Lyme disease decrease transmission risks to people. Hygienic practices like hand washing after handling feces or bodily fluids minimize infection chances. Human-animal interface risks. Approximately 60% of known infectious diseases in humans originate from animals, according to WHO estimates. This underscores the necessity of implementing robust preventive measures at intersection points between wildlife, livestock, and human communities. Training programs educating handlers about safe contact procedures further reinforce protective behaviors. Personal protective equipment usage becomes mandatory during birthing assistance or post-mortem examinations. Emerging threats. Adapting to climate change impacts. Rising global temperatures expand vector habitats, increasing incidence of tick-borne illnesses like babesiosis and ehrlichiosis. Warmer winters also prolong survival of certain pathogens previously limited by cold climates. Climate-smart farming approaches incorporate shade structures, windbreaks, and water cooling systems to counteract heat stress effects that weaken immune responses. Genetic selection for thermotolerant breeds offers long-term adaptation solutions. Predictive modeling, GIS mapping combined with weather forecasting tools anticipate regional shifts in disease distribution patterns annually. Sustainable practices. Agroforestry integration creates microclimates beneficial for both crop growth and livestock welfare amidst environmental changes. Community engagement. Strengthening collective defense mechanisms. Collaborative initiatives among veterinarians, farmers, researchers, and policymakers foster knowledge sharing and resource pooling for enhanced disease surveillance networks. Mobile veterinary units provide affordable diagnostic services to underserved regions while promoting best practice dissemination via workshops and digital platforms. Citizen science projects encourage public participation in tracking unusual animal behavior indicative of emerging health issues. Regulatory compliance. Ensuring standards are met. Governments establish legal frameworks governing animal healthcare standards aimed at minimizing economic losses due to epidemics. Accredited certification bodies enforce adherence through routine inspections and audits. Licensing requirements mandate proof of current immunizations prior to market sales or transport permits. Traceability systems enable swift containment actions during outbreaks by identifying affected premises rapidly. Conclusion. Disease prevention in animals demands multifaceted strategies combining scientific innovation, vigilant observation, and community cooperation. Every layer, from individual care routines to international policymaking, contributes toward healthier ecosystems for both fauna and humanity. To safeguard your animal's well-being, prioritize consistent health monitoring, stay updated on recommended prophylactic interventions, and engage actively with local agricultural extension services whenever uncertainties arise regarding optimal preventative measures.